Treating chronic fatigue syndrome, or CFS, with the use of alternative medicine and natural health strategies can be effective for some people. Scientific support is still lacking regarding the effectiveness of alternative medicine or natural health solutions for chronic fatigue treatment. What science does exist is often quite encouraging. In a moment, you're going to learn about 7 different alternative medicine and natural health therapies that may be of help to you in dealing with your ME CFS. One thing that's unique about CFS is that there are so many things that can differ between people who suffer from it. The symptoms of chronic fatigue and each person's specific fatigue causes can vary significantly. See the first video in this series to learn about some of the causes of fatigue, and watch the third video to learn more about the numerous symptoms of chronic fatigue syndrome. In the 4th and 5th videos of this series, you can learn about some amazing natural health supplements that have shown a great deal of promise for ME and CFS. The studies I mentioned regarding these 7 alternative medicine and natural health therapies are all conveniently linked below this video for you. Acupuncture was demonstrated in one study to provide benefits for dealing with fatigue for those suffering from chronic fatigue syndrome. In another study, transcutaneous electrical acupoint stimulation, or TEAS, was shown to be effective for relieving fatigue symptoms and the other potential symptoms associated with chronic fatigue syndrome. The treatment was used on the conception vessel and the governor vessel, and TEAS was also determined to be a safe alternative medicine therapy. Ayurvedic medicine is another option as a natural health treatment. Ayurveda is thousands of years old traditional medicine of India. A typical approach that Ayurveda might take would be to improve your digestion and eliminate toxins in your body with a detox program. Ayurvedic herbs are usually used for treatments. These would include herbs like ashwagandha, amla, bala, triphala, and lomatium. These herbs get combined according to what is known as your dosha, or constitutional type. It's the Vata dosha type that's thought to be the most susceptible to chronic fatigue syndrome. An extract from a type of orchid used in Ayurvedic medicine, commonly referred to as CCE, was found in one study with rats to be non-toxic, and it improved spontaneous locomotor movement, and it also decreased the participants' depression and anxiety scores. Other key biomarker benefits were also observed. Another possibility is DHEA fatigue treatment. DHEA is a hormone secreted primarily by your adrenal glands, but also the ovaries and testes. DHEA can be converted in your body to other steroid hormones such as estrogen and testosterone. It also affects your memory, mood, and sleep. Your levels of DHEA were at a peak when you were in your mid-20s, but then slowly decline after that age. Studies have shown that DHEA levels are abnormal in people with chronic fatigue syndrome. DHEA is not recommended unless lab tests indicate there's a deficiency. Treatment should be closely supervised by your doctor or a qualified health practitioner. There's not much that's known about the long-term safety of DHEA. Because DHEA is converted to estrogen and testosterone, people with estrogen or testosterone-related conditions such as breast, ovarian, prostate, and testicular cancers should avoid DHEA. Some other potentially adverse effects of DHEA include high blood pressure, lowered HDL, deepening of the voice, and other signs of masculinization. DHEA can also interact with some medications. For example, it has been found to increase the effects of the HIV medication AZT, barbiturates, the cancer medication cisplatin, steroids, and estrogen replacement therapy. So again, I must emphasize that DHEA treatment for any condition should be conducted by and closely supervised by your doctor or a qualified health practitioner. Isometric yoga therapy improves the fatigue and pain in people with chronic fatigue syndrome who are resistant to conventional therapy, according to one study. Qigong exercise therapy has been shown in at least one study to alleviate fatigue, anxiety, and depressive symptoms, improve sleep quality, and to shorten the time it takes to get to sleep for people with illnesses like chronic fatigue syndrome. Traditional Chinese medicine also identifies some problems associated with chronic fatigue syndrome. These problems are referred to as spleen qi deficiency, kidney yin deficiency, essence deficiency, and kidney yang deficiency. Seek out a traditional Chinese medicine practitioner to get your proper evaluation and the recommended fatigue treatment for any of these problems should it be determined that you have them. Be sure to mention that you have fatigue and whether you've been diagnosed with ME or CFS. Wei-on thermal or infrared therapy, which are essentially the same thing, have been shown in studies on people with chronic fatigue that their perceived fatigue significantly decreased after the therapy. Additionally, their anxiety, depression, fatigue, and overall performance status significantly improved. Levels of pain, however, did not change significantly. There weren't any reports of adverse effects during this study. Those are the 7 alternative medicine and natural health therapies that seem to have a good potential for sufferers of chronic fatigue syndrome, which are also backed by some real science. Please be aware, however, that self-treating a condition with alternative medicine therapies or natural health remedies and supplements to avoid or delay standard medical care may have serious consequences. Please also consult with your doctor or licensed professional healthcare provider first. Please be sure to subscribe to my channel, like this video, and click the bell icon so you won't miss any of the new helpful videos that I create for you. I've placed a link below this video to our core team of professional natural health practitioners too. These are trained and experienced experts that can help you with any health, physiological, psychological and/or emotional issues that you or a loved one might be dealing with. Many of them also have experience with helping people that are suffering from CFS. You can also work with them in a complementary way right along with your medical doctor, and they can do internet or phone consultations with you to help you sort everything out to find some relief.